Good afternoon. Welcome back to our webinar series entitled Frontline Report, Autoimmune Liver Disease and the Pandemic. This series of webinars are made available via collaboration between the Autoimmune Hepatitis Association and the Center for Autoimmune Liver Disease and Cincinnati Children's Hospital. I'm Craig Lammert, the Executive Director for the Autoimmune Hepatitis Association. I'm also an adult hepatologist at Indiana University. I'm excited to welcome you to the 8th webinar series entitled Staying Centered in an Unbalanced World. This webinar series does not replace your primary physician, gastroenterologist, or hepatologist. We cannot diagnose, treat, or manage symptoms associated with AIH. Any changes in treatment or therapy should only be done under the supervision and direction of your treating doctor or care team. I'm delighted to have Erin Anderson moderating with me today. She's the AIHA's Director of Programs and Advancement.
Hi everyone, it's great to be here today, Dr. Lammert.
I think the title of this webinar says it all. A world in the grip of the novel coronavirus pandemic has taken a toll on the mental health of many. I've seen this in my own life at home and in my colleagues, but also among my patients. In my hepatology practice, I've only been doing virtual visits with patients on a computer platform, but I've kept the same volume of patients though. It's become clear, especially among AIH and other autoimmune liver disease patients, there are increased complaints of symptoms such as fatigue, anxiety, depressed feelings, poor sleep, and even joint pain. Patients also complain of more clashes among their family, fighting with others in public or online, about anything from mask use to the country's leadership. I hear more about strained home relationships, lack of support from family and friends, unemployment, and even financial issues. These observations, coupled with real-world published data, make it clear we should be transparent and aggressive about confronting mental health issues during this pandemic. In fact, it seems more than 1/3 of Americans have displayed clinical signs of anxiety, depression, or both since the coronavirus pandemic began. And the long-term psychological consequences of collective trauma such as this pandemic can last a decade or more.
I agree, Dr. Lammert. The challenges of the pandemic on our mental health can be really immense. And that's why I am really happy to introduce our returning guest, Dr. Mary Montero. Dr. Montero is an assistant professor of medicine at Indiana University School of Medicine, where she has worked as a clinical psychologist since 2007. She is an expert in health psychology, and she has a special interest in patients with digestive and liver diseases. She's been a strong supporter of the AIHA. She's spoken at our conferences and she's presented at our virtual support group meetings. She's also presented in our second webinar called Coping with the Crisis of this COVID-19 Frontline Report webinar series. Be sure to visit our YouTube channel to watch that and all our other Frontline Report webinars. Welcome back, Dr. Montero.
Yeah, I'm so glad to be here.
Dr. Lammert shared a number of struggles he has observed among his own patients during the pandemic. In your practice, are you seeing a similar increase in these issues and challenges, and any other clinical observations among your patients that you have found concerning or unusual?
This is a difficult time for everyone. There's so much that's unprecedented that we've never encountered on all kinds of fronts. I know in my own life, we are changing work format, managing children format, how to get basic needs like groceries, like everything top to bottom is changing, not to mention how people feel about it. And then on the larger landscape, there are scary news stories constantly. A colleague just mentioned he was scrolling through news feed and checking for updates, and almost everything was negative. And I think it feels hard not to be overwhelmed. So, of course, I see patients who are already facing challenges, either medical or psychological or both. And with that, of course, the pandemic compounds what they're experiencing, medically and psychologically. So it's normal for our bodies to react negatively under stress. We have increasing heart rate, shortness of breath, shakiness, just feeling generally jittery or on edge, and that can cascade into GI symptoms or challenges with our immune system, and certainly muscle tension. Most of us recognize that feeling of our shoulders being tensed up and tight. So that at a minimum is what people might experience normally. And of course, with that, anxiety or concern about the future. So regardless of political affiliation, I find most everyone is experiencing increased anxiety for sure.
When your patients do tell you that they're experiencing this increased anxiety, what are your top tips for them to to help them deal with these stressful times?
I first start off by saying I would begin with empathy. This is just a really, really rough time for almost everyone. Regardless of your circumstance, medical or practical, I would just empathize. This is a really difficult time. And beyond that, I would look to use what we look to leverage in therapy as skills to maintain control or maximize our resources, whether through our thoughts, kind of like focusing the lens on a camera to shift the way we're seeing things, or our actual behaviors, protecting our sleep, staying as active as possible, and staying busy with things that make us feel practically focused and purposeful. Gives us a sense of meaning and productivity, can help be at least a useful distraction, but often provides some other emotional buffering. So looking to leverage our resources and control where we can is a place I'd begin with patients.
For me, I found that surrounding myself with beauty and nature has been helpful. As opposed to walking on the trails by our house, I've been walking in our neighborhood and admiring all the flowers in bloom. And I've also been driving to a nearby lake that I've been walking around. I've actually read some articles about how being outside can be a form of therapy. Have any of your patients found that to be the case?
Absolutely. There's actual data to support being in nature regulates our nervous system and our immune system. So we're coming to understand that that has a powerful effect for depression, for anxiety, as for our overall health. So for sure, I have a lot of patients who enjoyed that before the pandemic, and especially now are enjoying that during the pandemic because, right, provides some of the protective medical benefits with social distancing and being outside for our abiding by guidelines, but it also provides certainly psychological benefits. So for sure, getting outside where you can, I think is great.
I'm assuming, like all of us, this pandemic must also be affecting you negatively in at least some way. As a psychologist, you know all the tools and techniques out there. If you wouldn't mind sharing what has helped you personally the most during these uncertain times.
Sure. I'm glad to share. We're all human, and so whether you are trained in skills to manage these things professionally or just doing the best you can, I think this is affecting everyone just in unique ways, but with a lot of common denominators. One of the ways it's affected me and our family is all kinds of uncertainty with regard to school decision making at the moment. In the spring, it was scrambling for childcare, trying to figure out how to manage kids of different ages while being fortunate enough to still have work. And at the same time, keeping our heads on our shoulders and not getting too frustrated with the experience at home. So it's pretty normal to have increased friction when people have been having fewer outlets, they're out of their routine. And on top of that, we have the looming cloud of this overarching anxiety of what's happening with our country, what's happening with our health, and the possibility that things may get even harder potentially in the weeks or months to come. And so I think it would be hard not to have that translate into some scary feelings. So on a practical management side, we have laid out our options and tried to be rational about what we can manage. And then using the skills I have to try to keep the rest of it in check. In particular, mindfulness, I think, is a very kind of often used buzzword, but might kind of evoke an eye roll for lots of people because they think I don't know what imagery it evokes for everyone, but it's a really simple and easy way just to kind of get grounded in the moment. So instead of projecting, anxiety is mostly about thinking about the future, what's coming, and typically things tend to be more scary if they're vague and non-specific to your own needs. So trying to be as specific as we can about what's the concern, what's the need on the table. For example, balancing medical risk with practical realities, how much we can manage for our daughter's education at home, and what we're expecting may be hard about that, being specific about likely that means juggling challenges when she needs attention or support at a time where, for example, both occupied on calls or with patients. And so being as specific as we can then about the resources, what would we do in those circumstances? and anticipating how we manage that not only helps apply to the practical realities, but gives us a sense of control, like we can do this. It's not as vague and as looming or overarching as it might have been before. And mindfulness then is about not only identifying those realities, but then grounding yourself in the moment with what are the experiences that are affecting you now. A helpful way to do that, and I'll be glad to do a brief training in this after our conversation today, is to use the 5 senses with breath to try to keep yourself in the moment. And being aware with your senses of things around you in the moment helps bring your body and your mind into the present state, which helps by default reduce anxiety. So it's a pleasant thing to do, and it also helps keep your brain from spinning out of control, which is easy and understandable to feel these days.
Great. I think that exercise will be really helpful to all our members. I, like you, have little ones at home, and the school question is really stressful. We still haven't heard from our governor yet about what our schools will be doing in the fall. So I think that breathing exercise, I know I'll be using it. So I'm looking forward to that. It's starting to feel like this pandemic is never ending, and we know it's going to be here for a while. I think it would be easier in a sense to stop adhering to social distancing, wearing masks, etc. But we know all those things are so important. So how can we motivate ourselves to be safe and continue to take necessary precautions, even though it's really tough to do?
Sure, it is so easy when a threat is vague or distant, or the measures are a hassle, to kind of wear out from that after a while. It becomes kind of impersonal, as opposed to when something is specific and proximate, like it's affecting someone that you know, like, you know, you're 1 or 2 degrees away from someone. It's easier to take that more seriously. So when you, as opposed to like when you're, you know, seeing people getting groceries regularly, I think if we all want to hope that we're back to like getting a yellow light or even a green light to move forward back to our kind of pre-COVID lives and to be able to abandon all of these hassles. So we both want to not have the challenge, and then just the practical facets of the challenge, I think, make it easy to kind of distance from that. So the psychological answer to that would be to make it specific and proximate and relevant to you. So reading, for example, on even though this is kind of an evolving understanding, what we do know that to date that the novel coronavirus can do to the lungs, for example. If you're taking a look at what medical personnel are saying about the actual impact of that, that sure makes it more real for me. When it affects, unfortunately, probably many people have already had this experience occur, but when it affects someone that you know, or someone that you know 1 or 2 degrees away, that also helps it hit home a lot more, that you can be aware you aren't necessarily as immune to this as it can feel in theory when you don't necessarily know anyone that it's affected. Or if it's only affected you in peripheral ways like my kids' schooling or how I go about getting healthcare, but it hasn't affected you in the sense of a relationship, like knowing someone who has experienced this, or not being able to be with a loved one when they were ill in healthcare settings. So I would work on trying to identify ways to make that outcome specific and relevant. So what are the health experiences that you don't want to experience? For example, what are the symptoms? When I was trying to describe to my husband why I was concerned about health risks for our child, I mentioned the specific effects on the lungs that I was aware of and how I thought that would feel to experience it. And that helped him tune into, that's certainly something we want to avoid, and how do we need to practically manifest ways to protect our family and our children so that we can at least increase our chances of avoiding that. I would reframe that so that it's something accessible, so it's not just vague, but practical steps that you can do that are within your reach. And then lastly, it's always helpful to add a reward system. So instead of focusing on negatives like things we're avoiding or hassles we have to take, if you shift the focus like we might in therapy to something that you're doing well, that you could acknowledge I have taken these precautions today. I have avoided these risks today as like a skill set or an activity that you would, get a gold star for, get points for, is like you're saving up for something. Even though that might seem overly simplified, humans respond to really tangible reward. And so seeing, for example, on a calendar, days that you could check off that we've done this many days of successful cooperation with everything we know to be health protective, that would give me a visual reward, like I have accomplished something as opposed to avoiding something, if that makes sense. So focusing on the positives where you can, I think, can be helpful. It's understandable to respond better to positives.
That's a really helpful perspective. Thank you. I see many people being so productive during quarantine, at least according to social media, exercising a lot more, cleaning out their attics and basements, doing home improvement projects, doing really creative projects with their kids, making restaurant-worthy meals at home. I think many patients with autoimmune liver disease, though, are just trying to keep up with their regular day-to-day responsibilities. How do we stop comparing ourselves to others and feeling bad that we're not doing more?
I have really strong feelings about this because social media can be the source of a whole lot of emotional distress. It can also be, I'm sure, the source of many good things too, but social media is not balanced journalism. It does not fairly represent both sides of the story. It's more like a forum for sharing often what's going well in someone's life. So if we reframe that as not just a snapshot of a day in the life that's typical and encompassing a balanced view of both what's been challenging and what's been going well, we recognize this is maybe a highlight reel of things that are going well. It might be easier to take in context when people have great success stories to recognize that this isn't necessarily representative of their challenges as well as their successes. So we want to celebrate their successes for sure, but recognize that it's very human to have the challenges and not normally accessible for most of us to be making gourmet level meals or cleaning out our attics on a day-to-day basis. And particularly for people who are facing medical challenges, this is where I feel so strongly. It is very hard to continue to reframe our mindset to recognize the common denominators for people who have medical challenges are very different from the average population. And so being fair to yourself to acknowledge that the cards you were dealt or what you're dealing with encompasses so much more, and the very act of getting out of bed sometimes is already a huge success for people who are facing medical difficulty. And that's not something that, if you put a post about that on social media, most people would understand. But hopefully folks with medical challenges have a close social support system of people who can grasp that and can understand that at times just doing the very basics, getting out of bed and putting on clothes even, can be a major accomplishment for folks, equivalent to someone else's cleaning out of the attic. So just be really careful to reframe how well you're doing for what you have going on, so that you can give proportionate support to your own self for dealing with whatever realities you are facing, including challenges with stress as well as the pandemic fears.
Thank you. That's really helpful, I think, especially for autoimmune liver disease patients to keep in mind. I'm now going to turn it over to Dr. Lammert, who has a few more questions for you. Thank you again.
My pleasure.
Thanks again, Dr. Montero, for joining us. We really appreciate your willingness to be with us today. You know, there is a lot of information out there for COVID-19. It's growing every day. We could spend all day reading about it. I know my colleagues, for instance, and I talk often about how do we even keep up in this digital age, and particularly with the disease that we know very little about. Do you have any strategies you could recommend as a way to maybe blunt the feeling of data overload during this crisis?
For sure. This is a time I think almost everyone feels inundated and without clear direction of where specifically to go. It's up to everyone's individual choice, which the choice can itself be a little overwhelming. There's so many options, right? We no longer have 3 broadcast channels plus cable plus now internet, and it's available all the time. So there's know when to limit that. That's self-regulated, which itself again can tend to be on overload. So the drive to be informed is good. Obviously, we want to maintain some connection with reality. I have a lot of patients who, out of fear, continually seek out extra information, kind of like when you're fearful you have a medical, like a disease, and then you go research it on the internet. There's all kinds of scary things that come up that may or may not be relevant to you. And in the case of news, there's a lot of speculation as well as hard data, so it's hard to tease out what may or may not actually occur. So with that, I would suggest in CBT, we use both discipline around our thoughts and our behavior as a way to help leverage control. And so in this case, discipline around accessing news would be something I would encourage with news scheduling. So I've had a lot of patients have success when they pick a time of the day that works for them to intentionally access contact with the outside world in terms of news information. And they choose an outlet they feel is balanced and will not be overly anxiety provoking, but feed them with the information that they need to stay safe and be connected to the world. And then we may agree on a time, for example, 30 minutes, like the national news at 6:30, or their favorite provider on cable, and then they'll hold on to that as a way to acknowledge they're preparing for taking in news, digest it, and then after it's done, they may make a list of action steps they need to do, and then we intentionally have them connect to something else that's not engaged in the same way. So they might go then do something that engages both them physically and mentally, like cooking dinner or watching a funny show, playing with their pet, something that helps get their brain, their mind, and their heart off of the subject matter at hand. So they both intentionally engage and then intentionally unengage to help themselves cope. And this gives us a sense not only of like a balance of being connected and then actively disconnecting, but maintaining control. Like we are in charge of that fire hydrant as opposed to it finding us and seeking us out to inundate us with water. So it can inundate you if you don't have some regulation, that's for sure.
Absolutely, and I think we all probably could do a better job in terms of that regulation, and it does take practice for myself. But it leads me to think of another question. As I consume this information, even if I am very careful about the times that I decide to take in that information, there's a lot of negative pieces in the news. In fact, recently on vacation, I felt that it was almost every news story there was a negative spin, no matter what side of the aisle you sit. How do I stay informed without letting the negativity of current events really consume me as well?
Sure. And I would say, Dr. Lammert, you have excellently functioning mirror neurons. That means your brain is actively engaging with feeling alongside the things that you're seeing, which is no surprise for Dr. Lammert, no surprise for many of us who are feeling alongside the information we're taking in. So when you see something distressing on the news, it's a normal human reaction to feel sad or overwhelmed, and even have that kind of cascade into other parts of your life, kind of hang with you, especially with the frequency and the severity of the information, the bad news that we're getting in effect. So that's pretty understandable. With that, I think it's important not only to kind of reframe as you're taking in the information, but then help yourself continue to use a reframe long after you've had contact with it. So what do I mean by that? Reframing is like, I used this analogy before, like shifting a camera lens. So we're still taking in the same reality on the other side of the camera, but what we do with that is what makes the difference emotionally. So when we see something like, job losses that are affecting people economically, I think that's just fear about money is just a terrible fear that can feel like termites eating up a house at its foundation. That's just scary from the ground up. And of course, that's a good measure of our human compassion to be aware that that is very hard for people. What I would do with that is acknowledge the feeling and then try to help translate that into some action that we can either mentally or practically take that helps us feel like we're doing something with it. It will give us a sense of what we call agency, like we're in control, like I mentioned with the example before, but also help us find something positive to counterbalance It may not be proportionate to the news that's going on, but there's no way on a one-on-one level to actively counterbalance that. So for example, if you read about job losses or hear about someone who's experiencing medical great difficulty, I would acknowledge that that's just a really awful thing to perceive, and focus on then places that you can take charge of that feeling to do something that helps you feel you're counterbalancing that. In what ways are you exhibiting compassion in your family at home? In what ways are you able to contribute to the community? If you feel like there's been something negative happening in the community, how can you contribute back? That may be as small as posting a sign on your door thanking the mail carrier for dropping off, you know, what you need on a day-to-day basis. That may be mentally inside your heart, taking, acknowledging with gratitude the things that you do have going on well. That may be action on a larger scale, but places where you can kind of mentally or even practically counterbalance that, I think would be helpful. And again, lastly, acknowledging that distress itself is therapeutic. This is hard for everybody.
Yeah, no, I think those are great tips and a good way to reframe as well. I personally am lucky that many patients or people in my life share some similar concerns and apprehension about the pandemic. However, I have a number of patients that struggle. We've talked about social media. This has been a challenge for them because they have people that they love in their life and trust, but they're very vocal about misinformation possibly being broadcast. And it brings conflict to them and adds to their angst and their worry. And it got me thinking, do you have any other strategies that you think are helpful in dealing with, I'll say, challenging people or others that maybe don't share similar beliefs or structure or sentiment that you do, like the non-mask wearers or civil liberty defenders? You know, I've had someone in my clinic say their family member thinks it's all fake news. Any approach that you think would be healthy and appropriate?
Sure, I appreciate you bringing this up, Dr. Lammert, because this is something that has really bothered people I know in my personal life and bothered a number of patients. In fact, I've had people enter therapy just because of those issues. It's been so devastating. This happened with the last election cycle, and again, I see happening now. So I would acknowledge again, good that people care. There's a common denominator that we have to care about people around us and care about our society, to be invested to the point that you have an emotional reaction as opposed to apathy, like we don't have any investment in our society. With that being said, I would add our brain processes information very differently if there's an emotional charge. So if it's just logical information, that's just kind of taken in neutrally. But if there's an emotional charge around it, there's a whole different pathway that the brain takes. And when we get off on that emotional charge, it's really hard to recenter onto the logical end of things. So the degree to which you can kind of keep the emotions recognized but separate is helpful for your own decision making. And then I would use a reframe that we focus on often in therapy, which is kind of like acknowledgement, but you know, separate, but I don't know, I don't want to say separate but equal, separate but independent maybe. They can have their beliefs and I can have mine, and mine don't necessarily have to affect theirs or vice versa, meaning there's kind of room for everyone to have their own space. And back to the emotional reasoning that we talked about earlier, it's easy to have as you feel, to feel that therefore that makes it true. Just because someone makes a statement doesn't necessarily change the reality around us. I would encourage a gentle and compassionate acknowledgement of that's an intensive feeling that someone has, and then to make room for you can have your own feelings on a separate spectrum and have that take up its own space. So I understand that's very difficult to do, whether you're at a Thanksgiving dinner and somebody's bringing up some very firm political beliefs, or you see things on the news that may not be happening right in your neighborhood, but are very ethically or politically important to people. This brings up a lot of emotion, and that's really valid. However, we have room in this country for everyone to have their own beliefs, and so I would just kind of allow that's okay for them to have theirs and me to have mine, if that makes sense.
Yeah, no, that sounds great. And again, part of that is I again, from my perspective, it seems like we're seeking that support from our networks, and whether it's social media, but friends and family. But a number of my patients also, besides looking to those aspects, they realize that they don't have that, or they don't have that close family or friends that they could really lean on in a time of crisis or anxiety. I've been encouraging to try to reach out, but is there a way that you can open a conversation, or how to leverage those relationships to do them and maybe yourself better as well?
Social support is incredibly important. In other words, to not feel alone. And sometimes we have folks around us, but we haven't really engaged that support, meaning taken the relationship to another level to, number one, let people know how we feel. Sometimes they don't even know on our side what's going on. So the first step would be to identify what we're feeling inside and then to communicate that. And the more specific we can be, the more chances we have to get our needs met. So if we can, we might try kind of an invitational statement, something like, you know, I don't know if you're feeling anything like this, but I realize this pandemic has made me kind of scared for what's going on, and I feel a little bit alone. We're kind of isolated, especially without having the regular social connections like we would normally have the opportunities to get together. Are you feeling anything like that? And then having, with an invitation, you know, phrased in your own comfortable way, that might open the door for people to respond. If they don't respond to an initial invitation, you might try even more specifically asking for what you'd like. That might be something as general as just an awareness that someone knows how you feel. That might be something much more specific, like I would enjoy the chance to connect by phone more often, or have a video meeting. I find myself in my own life, I'm doing that with patients so much, it now feels like a regular phone call is not sufficient. I want to see someone's face because I'm used to doing that all day long with work. So you might try inviting that, and you can't control, of course, how someone else responds, but you sure increase the chances of getting what you need or what you're hoping for if you ask for it. So tune into what you want, gently frame that in a way that might make that palatable to someone else, and then you might try floating that to see if you get a positive response. And no matter what, you have the benefit of recognizing what your needs were and working proactively to try to get them met, which is another way of taking control.
Yeah, I think that's really great advice, and sometimes taking that first step is the hardest, obviously, but it definitely seems like it can lend to a lot more support and more fruitful relationships as well. I think in those individuals that still don't have that, or even if they do have it, I think we're always worried that have we gone to another level that we're kind of beyond our own interventions, and are there certain flags that you look for, would consider with your patients that, hey, this is a threshold, you need to think about getting professional care or mental health involved in the care of your own issues? What do you look for?
What a great question. And I would just acknowledge and appreciate your compassion to be aware of what other people are feeling. Imagine a lot of people in family or, you know, close friend circles feel that way. They're worried about how their loved ones are doing. And how do you know when enough's enough, so to speak, that people need to get bigger levels of support, greater levels of support? So it's sensitive to be asking. This is certainly an area we want to be careful about. The most urgent concerns are when someone is potentially a danger to themselves or somebody else, or is getting disconnected from realities in ways that could be a risk like that. So if someone has mentioned not wanting to be alive or feeling like life was too overwhelming to make it worth living, that is a red flag that merits getting help immediately. So I never take those statements lightly. I always follow that up by a question as a professional. What does that mean? Tell me more about that, and outline very specifically when they felt that way. Do they have a plan? What would they do to make that occur? What could prevent that from occurring? How do they justify staying connected and wanting to keep going? And for less risk, and by the way, that's me as a professional. In personal circumstances, that's no one else's responsibility to make those inquiries or find out those specifics. That's the job of a mental health provider. So there wouldn't be the need to inquire like that. You just want to help people get connected for care, and then mental health professionals can take it from there. Other measures of concern are when people are having a hard time functioning. So either when symptoms have reached a level of severity or people can't do the things that they normally do. That might be kind of in a passive way, like having a hard time getting up and getting going in the morning, or in an active way, like having a hard time controlling anger or anxiety. So when it gets to the level of interfering with functioning or significantly in relationships or quality of life, we would also consider those at least yellow flags to get somebody connected for care. And there are resources available in everyone's community. And as a last resort, the emergency room or 911, if something is severe, that's what emergency resources are there for. So if the need is there, don't hesitate to use them.
Dr. Montero, I want to thank you again for joining us today and providing us with your thoughts to help us navigate our worries and our struggles during this pandemic. So thank you.
Oh, my pleasure to be here. Thank you for offering this opportunity for connection. This community has just been a terrific thing in and of itself, and an inspiration, I hope, for lots of people to get connected in the ways you all have created. Thank you.
And I want to thank you for watching today. We hope you learned something new and continue to realize the importance of good mental health during the pandemic. I also want to thank the collaborators of the AIHA, specifically the Center for Autoimmune Liver Disease and Cincinnati Children's Hospital. We hope you'll join us again for our next webinar, but I invite you to stay with us for a few more minutes as our community will experience a guided mindfulness exercise with Dr. Montero. Thanks again.
Thank you so much for having me. Especially in times of stress, it's normal to feel overwhelmed in our thoughts and sometimes in our bodies. And mindfulness techniques can help us kind of reground ourselves in the moment and therefore get better control of our thoughts and our physical reactions to anxiety. Mindfulness is essentially tuning in to our present experience without judgment. So feeling connected to what we're thinking and what our bodies are experiencing in the moment, but with acceptance and compassion as opposed to judgment around our bodies or our thoughts and feelings. So with that, let me just do a brief exercise to introduce how you can quickly and side effect free engage in an anxiety reduction technique that can help during the pandemic with worries and fears that can be at times overwhelming, or with any stress in your life. Mindfulness is helpful even for depression. So we've got loads of resources in the literature, and I hope this may be useful to you today. So we would start by taking in a deep breath in through the nose, all the way down to the lower lobes of your lungs. So you feel like a balloon puffing out in your belly, and then exhaling through the mouth like you're blowing bubbles, trying to hit the computer screen. So we just repeat that twice before we begin. Let's take a deep breath in and hold and release. Be sure to make that exhale even longer than inhale. One more time, in, hold, and release. And as you continue that deep breathing, you can imagine we're going to travel just briefly through the senses to help ground ourselves in the moment. Let's begin, first of all, as you take in that next deep breath, with what your body is experiencing with the physical sensation of touch, where your body is supported against the chair, your feet are supported on the floor, your spine is likely supported against whatever's supporting your back. As you take in the next breath, just imagine kind of traveling mentally head to toe to see where your body is in contact with its surroundings in space. Next, as you take in another breath, you might be aware of temperature and the environment directly around your body. Is there any breeze blowing around you? Is it kind of cool or warm? Feel like your body's able to move freely or comfortably in the space that it is in. As you take in the next breath, if you can imagine then focusing on the sense of sight. What are our eyes taking in? What's the light quality like around your body? What's physically in the environment? Are the colors pleasing? Do you feel like you have a room, or are you in a space that's more intimate? Next, let's take in the sound, the sense of hearing. So you take in another deep breath. You can consciously just become aware of the sounds, obvious and subtle, in your environment. It might be as subtle as your computer humming. Certainly, your body is itself probably making some noise in the environment. There might be slight movement of your chair or your hands against a fabric on your body. And next, let's focus in on what's happening in terms of smell. That's a sense we don't consciously take in often. But as you pay attention today and take another deep breath, you may become aware of what's in your environment. Even if it seems subtle, you can probably detect something specific that's around you. And so too with taste. There's all kinds of sensory awareness with what's happening with our tongues, and so too inside our bodies. You may then kind of mentally travel down your esophagus, down into your gut, become aware of what your body's feeling in the center, in your back, and in your periphery, what's happening in your arms, legs, hands, and feet. And mentally travel back up your neck, take in awareness of what's happening at the back of your neck and your shoulders, and then up to the top of your head. And with one last series of breaths, just imagine centering yourself with all this awareness in this moment in time.